Vice President Allison Carlson for an interview with Dr. David Walton, the U.S. Global Malaria Coordinator for the President's Malaria Initiative at the U.S. Agency for International Development.
Dr. Walton, thank you so much for joining us today. We're really excited about this. So to start off our conversation and just to level set a little bit, as the coordinator of the President's Malaria Initiative, could you provide us a brief overview? What is the status of malaria globally at the moment, and what are some key points that are underappreciated or not well understood?
Great question, and I would love to. I think it's important to put it in a little bit of historical context. And so if you look from around 2000 to today, and you sort of look at the progress that we've been making in the fight against malaria, from 2000 to about 2015, if you looked at the graph of decreasing deaths, decreasing mortality, decreasing cases globally, just incredible progress, introduction of new tools, countries making huge progress. And then in around 2015, the inflection point of the graph started to flatten out a little bit. And so, we began as a community to sort of say, this is a little bit different. And then COVID happened, and for the first time since those huge gains, we actually took a back step, and cases increased and deaths increased. And so we find ourselves in 2023 in a very precarious and fragile place as it pertains to malaria. And I think there's a couple things to highlight. Number one, if you look at the population in malaria endemic countries in 2000 to 2023, the population's doubled, right? So we have a lot more folks who are at risk of malaria. We have warmer and wetter climates. We have more extreme weather events. And so when you look at events like the floods in Pakistan, or you look at Cyclone Freddie, we have much more malaria in ways that are a bit difficult to predict. We have increasing insecticide resistance, which is commonplace, right? Like we're always chasing the mosquito, and it continues to elude us in innovative ways. And then we have, for the first time since chloroquine, the mainstay of the therapy of treatment for malaria, artemisinin, and those combination therapies, we're seeing resistance. And so, these things are combining to really create significant threats. And I think last but not least, there's a new mosquito that carries malaria coming over from Asia into Africa. And the difference between this mosquito and the other mosquitoes that have been around for a long time is that this mosquito lives in urban environments where most of the transmission happens in rural environments. And this mosquito is much more durable. And so as climate change drives people from the rural sector to the urban sector, and now you have this new mosquito, the threats are quite serious. But allow me to not be overly negative. We have some amazing opportunities on the horizon. Most of you have heard that we have a new vaccine that was approved by the WHO, and that is underway. The supply is a bit small, but things are moving forward. There's a new vaccine on the horizon. Hopefully we'll see that soon. We also, I'm happy to say, thanks to incredible bipartisan support in Congress, PMI is expanding to 3 new countries within sub-Saharan Africa. And then finally, I think along with USAID and PMI, we're really thinking about how do we create more local expertise in malaria and strengthening of that capacity in malaria endemic countries. So really, at the same time that we have a lot to deal with and it's a very fragile time, great cause for optimism.
Yeah, absolutely. And you pick up on our last conversations as well about environmental impacts and these changing dynamics that are increasing the challenge and really requiring multidisciplinary responses to these complex challenges. And you mentioned localization. I'd like to pick up on that as well. I know that's a big focus of USAID and USAID's strategy. So when you think about that and your anti-malaria work, how is that manifesting? How are you reaching communities on the ground? And I know also you've worked on the ground as a physician in Haiti with Ebola. And so when you're thinking about that now as a coordinator, how can you reach those local communities as part of your strategy?
Great question, and it is a good callback to where my career started, really working in solidarity with communities and living in those communities. And I think when we think about localization at the agency level, USAID agency level, and PMI, we're really thinking about how do we change the way our assistance is being distributed, right? And how we really focus on malaria endemic communities and malaria endemic countries. And shifting, as Administrator Power says, shifting the small a agency, that locus of control, over to, from, say, the folks who have traditionally had it, like us, actually, to those folks in these countries who have significant amounts of expertise, but very traditionally limited access to funding sources like USAID and other governmental agencies. And so, we're doing that in a variety of ways. Number one is we're really, as I've noted, trying to shift awards that we make, so funding from, from traditional incumbents really to local organizations in these communities. Number two, we're really trying to think about localization as much broader than, say, awards. And so what does that really mean? It means that, for example, how are we shifting and strengthening capacity in these communities? PMI in 2022 alone supported over 100,000 community health workers, which are the linchpin, I think, of our ability collectively, globally, to really make incredible gains in the fight against malaria. When you look at countries across the board who are making significant progress in really decreasing cases and deaths, it is the strength of their community health worker program that largely is contributing. It's multifactorial, obviously, but that's a significant component. Secondly, I alluded to or mentioned drug resistance. As we think about drug resistance, it's really important to understand, at least understand where your resistance is, right? Where is the drug resistance happening? And so traditionally, PMI has been integral in collecting those samples and then sending them to the CDC, right? Because PMI is an interagency collaboration between USAID and CDC. And the CDC is an absolute essential partner of ours. And so we would take all those samples from Africa, shift them all the way over to Atlanta. And yet, we realize and understand there is significant and robust expertise and scientists and amazing labs on the continent. And so how do we shift that focus? It decreased costs, but in fact, it puts the agency and small a agency and expertise where the diseases really are. And so that's yet another example. And so there's many others. For example, really shifting our support, say in Zanzibar, for indoor residual spraying, which is spraying the walls of homes with insecticides. So when the mosquitoes land there, they die. It decreases the ability for transmission indoors. Shifting that fully from what we were doing it as PMI to fully shifting that to being really operated and owned by the government of Zanzibar, right? And they're doing an incredible job. And so these are the things that we're trying to do slowly but surely over time, because again, this is going to take a significant change in how we do things, but we see this as really the trajectory as we move forward of how we're going to shift the focus to these and expertise to these malaria endemic countries.
If I can pick up on a few things that you mentioned. When you mentioned anti-malarial drug resistance, I know drug resistance in general is a growing concern, and your efforts to understand impact, collect data, as you said, share it with the CDC. How is that data and information then being shared with regional governments, local communities, so that those decisions and that planning can be more evidence-based and data-informed?
Excellent. And so it gets to actually how we work, PMI works with our partner countries. We work essentially, the core way in which we work is we are fully and often embedded within the Ministry of Health, more specifically the national malaria programs, which every Ministry of Health has when they have malaria that is endemic in their country. And so we sit with them, we work with them, we're in lockstep with them. And we see our role as being able to accompany their journey, right? And to support and buttress their efforts with their funding, with their expertise, both from USAID and from CDC. And again, working with our implementing partners and with our local partners on the ground. And so, the data that we collect, specifically anti-malarial drug resistance, we are guided by and informing the ministry, really sort of in real time, and working with them. And again, this is part of the shift to say, for example, in Senegal, we're able to shift all of that work to the labs in Senegal. So there's no shipping or sort of, having to sort of coordinate. It reduces the burden. It reduces so many of the things that I think can get in the way of our ability to actually be effective in the fight against malaria. So it's incredibly exciting as we look forward in terms of where we're going in the fight against malaria.
So to that end, PMI is in 24 countries in sub-Saharan Africa, 3 programs Southeast Asia, and as you said, you're working directly with governments. And so for those who are here today and those joining us online, what would you say are some of the, lessons learned about ways to work effectively with governments and make those connections and entry points? I think we're really focused on building those bridges and those connections so there can be greater understanding, data sharing, et cetera, on those solutions. So what are some of those effective lessons learned?
I think some of the most important lessons learned that we have are, understanding that we have a significant amount of expertise and a skill set. And again, part of being embedded within those ministries is to say, inform us, let us know, what is the support that you need? How are we going to help you level up, as it were, to be able to, because that's what our role is, really to sort of buttress their ability to do this. What are the things that you need, both in the short term, medium term, and long term? And what are the tools that we have in our toolkit, and what is the expertise that we have, and funding, to be able to sort of achieve those goals? Again, they're very clear short-term goals, and those are often tactical. And then what does it look like in 10 years' time to have a little bit less of sort of PMI as steering the ship and more in the passenger seat and not in the driver's seat, right? That's our vision, that's our goal. And so as we work with these governments and these national malaria control programs, we find that is one of the most effective ways to work with them, is really be guided by them as opposed to guiding them.
And I appreciate what you said about it not being just about the crisis response, that you're in it for the long haul and being guided by them. So thank you for your work, and thanks for being here to share your expertise with us, and all the best.